There is a public health crisis among pregnant African American women. This crisis cannot just be written off by factors such as their health status, access to healthcare, income level, or education. The number of reported maternal mortalities in the U.S. have steadily increased from 1987 to 2016 from 7.2 deaths to 16.9 deaths per 100,000 live births. During 2011 through 2016, the pregnancy-related mortality ratios for African American women were 42.4 deaths per 100,000 live births, compared to white non-Hispanic women 13 deaths per 100,000 live births. This difference has remained unchanged. The CDC defines pregnancy-related deaths as the death of a woman while pregnant or within 1 year of the end of pregnancy, regardless of the outcome, duration, or site of the pregnancy, from any causes related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. The data from the CDC shows that more than 60% of pregnancy-related deaths are preventable. This translates to every 5 pregnancy-related deaths, 3 of them could have been prevented. African American women are more than likely to die from preventable pregnancy-related deaths than any other race. They are 2 to 3 times more likely to die from pregnancy-related causes than white women. Even in states where the pregnancy mortality rates are low, African American women pregnancy mortality rates are 3 times as high as white women. Even a highly educated African American woman with access to quality health care is still statistically 5 times likely to die from pregnancy-related causes than a white woman with similar education. These inequalities increase by age. African American women who are age 30 and above are 4 to 5 times more likely to die from pregnancy-related deaths than white women. Both societal and health system factors contribute to these high rates of poor health outcomes and maternal mortality for Black women, who are more likely to experience barriers while obtaining quality care and often face racial discrimination. In a recent study of California women enrolled in Medicaid, Black women were less likely than white or Latina women to receive postpartum contraception, and when they did receive it, they were less likely to receive a highly effective method. Hospitals that serve predominantly African American populations provide lower quality maternal care than other hospitals. They also perform worse on 12 out of 15 birth outcomes, including elective deliveries, non-elective C-sections, and maternal mortality. The Maternal and Child Health Services Block Grant, also known as Title V of the Social Security Act, is the oldest known public health program in the United States that is federally funded. They fund programs and services that solely focus on aiming to improve the health of mothers. They also provide gap-filling prenatal health services to 2 million women. States who use Title V funds are required to spend a minimum 30% of the funds on preventative maternal services for up to 1 year after giving birth. In 2018, Title V funded 59 states and jurisdictions to provide health care and public health services that 90% of all pregnant women benefited from. This policy addresses the maternal health disparity among African American women because it funds federal and state programs that directly and only support access to quality health care for mothers and comprehensive prenatal and postnatal care for women, especially low-income and at-risk pregnant women. What can you do to help? As a public health professional, you can become an advocate for high-risk mothers so another child won't have to grow up without its mother.